So good morning, everyone, and thank you again for the opportunity to present our work on testing the effectiveness of an opt-out strategy, antenatal testing of HIV and syphilis testing uptake in Luzon, Philippines. So I have no conflict of interest to declare, and just to start this discussion, I would like to review everyone regarding the HIV and syphilis in numbers, both globally and Philippines. So since yesterday, we have learned that although not in the speed that we like, HIV cases has continued to drop globally, while syphilis cases has continued to increase. However, in the Philippines, we note that both HIV and syphilis are continue to increase in numbers. And most of these cases are actually in key population, particularly in men having sex with men and their partners. And as seen, the values are low for women, with only 0.01 prevalence of HIV in women, and about 1% of syphilis in ANC. But despite these numbers, we see that the mother-to-child transmission rate in the Philippines, as reported by UNAIDS Spectrum, is at 39%, alarmingly high. And congenital syphilis cases, although the evidence is scarce for our country, a report showed that an incidence or an estimated incidence of 1 to 1.5 per thousand admissions. And this data is given to us with a testing rate that is very low at 26% for HIV and 30% for syphilis. With that, given the situation, we performed a cross-sectional study in tertiary hospitals in the regions with most HIV cases. We wanted to investigate if an opt-out approach, while addressing the cost, as well as providing accessible testing and improving the knowledge of the mothers, will increase testing uptake. We then also explore if the prevalence in this study is comparable to that of the national data. In this study, we included women who are age 18 years old and above, and who do not have any testing done for HIV during their current pregnancy. Any women who already know their status, as well as have had testing for the current pregnancy, were excluded. The schematic diagram of the research is located at the bottom part of the slide, but I will be discussing them in details in the succeeding slides. So for this study, we have 2 testing sites. We partnered with 2 tertiary hospitals, which have high volume of patients with trained personnel capable of doing the research, and a laboratory and treatment center that can handle HIV and syphilis cases. The first site is a tertiary hospital in Region 3, north of the capital, where 12% of cases are recorded. It has a 1,000-bed capacity and has an estimated 3,500 number of deliveries. Our second site is the National Maternity Hospital of the Philippines, wherein there is 700-bed capacity and has an annual delivery of 10,400. So after we secure the consent of our study participants, we provide a 15-item questionnaire about prevention of mother-to-child transmission information, asking about their knowledge of the disease, their attitude and practices regarding condom use, partner testing, amongst other information. After answering, they then receive pre-test information, and unless they opt out, they will undergo on-site testing, and if necessary, referral for confirmatory testing and treatment in the facility. The study makes use of BioLine HIV Syphilis Duo Rapid Test Kit, which was provided to us by Global Fund Philippines. The research assistant for this study all receive retraining, particularly in providing pre-test information that are centered to women and mothers. So in the 6 months that we were able to collect data, we were able to enroll a total of 1,385 pregnant women with a median age of 27 years old and an age of gestation of 28 weeks. Note that about half of these participants are already on their second or more ANC consult, but still did not receive HIV testing. Of all the participants, only one opted out to get tested, citing to ask for her husband's permission prior to receiving the test. Our computed prevalence is at 0.07 for HIV and 0.36% for syphilis. Also, from the 15-item questionnaire, we note that more than half, or that women are more knowledgeable about HIV than syphilis. Only 52% of our participants have heard of syphilis. Majority of them are willing to accept the results, but are hesitant to disclose the results. And 95% of them agreed with partner testing. So opt-out and point-of-care testing has shown to increase the testing uptake for both HIV and syphilis. This strategy addresses the identified factors published by the Department of Health, an exploratory study on women living with HIV, particularly addressing the infrastructure and cost. Moreover, by offering the services in a routine setting and revising the messaging, that this screening primarily aims to improve maternal and the health of their infants, we were able to increase, or rather to reduce stigma. Our strategy is also consistent with the recommended trend of integration in order to improve outcome. The difference in the prevalence from national data and our values puts importance to improve testing, as the current numbers may be underrepresentation or overrepresentation of the true magnitude of this disease. In conclusion, universal testing for HIV and syphilis as using a rapid point-of-care test is feasible and acceptable in the Philippine context. This strategy increases testing coverage and can increase detection of cases. As the Philippines continue to improve in HIV awareness, citing in fact that recently our Department of Health Secretary just announced it as a priority, we must also put similar effort to increase syphilis and other STI awareness to achieve elimination of mother-to-child transmission. Lastly, continued exploration of tailored health programs, such as partner testing in antenatal care, should be considered to reduce both neonatal HIV and congenital HIV syphilis cases. That ends my presentation, and I would like to thank again my local and collaborators from Thailand who helped me make this study feasible. And with that, I end my presentation. I'm happy to take questions at the end of the session.
Yeah.